the station that is local for you. NBC4 at 11 starts now.
That an ambulance driver apparently fell asleep at the wheel in neighboring Indiana comes just as Ohio lawmakers are considering a bill that would eliminate mandatory overtime for nurses. We've been reporting on this bill that's opposed by the Ohio Hospital Association that claims it is overly broad and would hamper the ability of a hospital to adequately staff up in emergencies. But the bill is backed by the Ohio Nurses Association that claims mandatory overtime forces nurses to work to an unsafe level of exhaustion. And they point to a Johns Hopkins study that found preventable medical mistakes are the third leading cause of death in the U.S.
We care that patients get safe care, and that's unacceptable. Nurse fatigue has a huge impact on errors. We're human beings, and when we're not able to make sharp, keen decisions, the errors happen.
What kind of limits do you think there should be on overtime for a nurse who is exhausted?
Well, one thing I can tell you, Colleen, is that we definitely share the concern for patient safety. We share the concern for preventing any type of fatigue of healthcare worker, and our hospitals have taken great lengths to make sure that those two issues are priority.
Now, after those interviews aired, we heard from dozens and dozens, hundreds really, of healthcare workers, and our story that was put online has been viewed more than 182,000 times, shared by 1,100 people. Most of the people I've been hearing from are healthcare workers who say that they are really exhausted. Sandra tells me any employer who has mandatory overtime constantly with a short staff is running the risk of harming patients, and they need to hire more workers instead of making working conditions unsafe. Megan tells me you have nurses who may be on their third 12-hour shift in a row and then getting mandated to come back and work more overtime. She says that cannot be safe for anyone. She is a nurse. But we also heard from a nurse who says there should be no such thing as overtime that is mandatory. Now, she says she works for Ohio Health. Ohio Health, where she works, says does not mandate overtime as a form of staffing. And as a result of that, the nurses are more likely to volunteer to work extra hours to help their coworkers who need a break. We have been hearing from a lot of you. We will be taking more comments from you online, and we will continue to follow the progress of that bill.